Hello everyone. Once again, welcome to our YouTube live channel. So basically, today we are mainly introducing a new novel branch in field of gynecology, as well as it is also considered as a combined branch, aesthetic branch. So today we are mainly going to talk on novel branch, that is cosmetic gynecology, and especially in cosmetic gynecology, PRP therapy. There is one more good news that I am Dr. Alpa Chavda, Medical Director at Madhudeep IVF Center and working as a Chief Clinical Embryologist. Now coming up with this new therapy, and now today main two important person is also going to join us on the YouTube live. That is Dr. Gaurav Chavda, Medical Director of Madhudeep IVF Center. He is laparoscopic and hysteroscopy surgeon as well as infertility expert, and he is doing his novel work since 20 years at Madhudeep IVF Center. And the another is Dr. Suryakant sir. He is like a pioneer in this PRP therapy since more than 20 years, I can say, and he has trained lots of our gynec fellow as well as a other branch fellow, and he is considered as the Bhishma Pitama of this PRP therapy. So he is also going to talk on this. So you will have a beautiful knowledge on this field. So without wasting time, let's start today's session. What is cosmetic gynecology? Because every day new and newer things are coming up in the market. So as a doctor or as a clinician, we always curious to become updated in our branch. So this is since a long I am following this branch, and I also thinking whether I should come into this branch or not, because I am doing very good work in field of infertility. But I am seeing lots of the patient along with infertility in this field, and then I observe, I met with Dr. Suryakant sir, and other experts. Then I came to know that this is a very good branch and it can help in a more superior way in our gynec patient as well as in our infertility patient. So that's why we come up with this new branch. So what is cosmetic gynecology? Everyone is talking about cosmetic gynecology, cosmetic gynecology. The term is wrong actually. There is no such a word that cosmetic gynecology. Instead of, we can say it's a aesthetic and regenerative gynecology is the right term, not the cosmetic gynecology. Aesthetic and regenerative is considered as a medical term. So we are not promoting cosmetic gynecology, but everyone is nowadays talking about cosmetic gynecology, cosmetic gynecology. So that's why I had to put my topic name as a cosmetic gynecology. So why this branch is come up? So female genitalia have some physiological and the sexual function, a branch in which different modalities include surgical and non-surgical process. So it combines two ways. So you are included in surgical or non-surgical way. So two points are there: surgical cosmetic gynecology and non-surgical. Helps to maintain both the modalities. So again, question mark. Really it works or gimmicks? No. Really it works. I had seen lots of the patient. If you are doing in a good, proper way and following a standard protocols, then it is going to be work. Nowadays, I am seeing a bunch of mushrooms. Even the beauty parlors are come up and they are telling that they are doing aesthetic work, hydrofacial, hair transplantation. So everyone is doing. So that is I'm not I'm not telling they are doing wrong thing, but as a clinician, as a medical person, if we apply anything, it should be in a standardized manner, and we have to follow the standard protocols for that. If we follow the standard protocol, then definitely it is going to be work. Human body, either male or female, have the same function and effects all over the body is same. So like if we take an example, if we apply laser or HIFU on the face or the abdomen, like since a long, this is working by the VLCC or a person for weight loss, inch loss. So they are following this HIFU technique for the inch loss therapy. So if we apply laser or HIFU on the face and the abdomen, and if it works, so definitely it is going to be work on the female genitals and the male genitals if we following the standard protocols. So now come up with the cosmetic gynecology has many sub branches. So in this branch, whatever the important thing or whatever we are interested to our patient, that we can come up with this. So first is regenerative cosmetology. That includes platelet rich plasma, that is the PRP therapy, stem cell therapy, fat grafts and the exomers. Then the fillers, that is botulinum toxin, hyaluronic acid for the vaginismus. This we can include because many of the vaginismus patients are come up, we always telling the counseling is important, but like sometimes not only counseling is going to be work in such kind of the patient by following the standard protocols, just by injecting the botulinum toxin, it flaccid the vaginal muscles, and that is like the effect will last very for the few for 4 to 6 months. But during that time, along with the psychological way, along with the counseling, if we add this, then definitely it is going to be work. Then the lasers also are available, that is the diode laser, CO2 laser, HIFU, HIFEM. Nowadays like Amsela chair are available in the market. Just sit on the chair and your whole everything will be gone and you will be perfect. Then the radio frequency devices, this all lasers we can apply for the stress urinary incontinence in the mild stress urinary incontinence cases, for the vaginal tightening, for recurrent vaginal infection, dryness of vagina in the menopause. Then comes the surgical cosmetic gynecology procedure. So that also we can include like vaginoplasty, hymenoplasty, perineoplasty, labia enhancement or the reduction surgery, clitoral surgery, mons pubis reduction or enhancement. So if we follow this, this actually is our cosmetic branch. So we can apply, this is a novel branch we can apply in our branch. So we can help to the patient in such a way that this is our work, like doing hydrofacial or hair transplant. I am not telling that is bad thing, but we mainly focus on our branch and we have to transfer the benefits to our patient, those who are suffering. So I told you all about how and where the cosmetic gynecology will going to be work and how can we apply that in our branch. So it's a very simple thing, but only just we have to follow the trends, we have to follow the standard protocols. So one by one we'll going to be talk, but it's a very long lecture. But today our experts are there, that is Dr. Suryakant sir. He is master in the PRP therapy. So for that, today we are only going to be talk on the PRP therapy in cosmetic gynecology. Now onwards, the session will be taken by Dr. Gaurav Chavda. Welcome Dr. Gaurav Chavda.
Hi everyone. Sorry for delay. It's just a matter of time. So let's start. So today's topic is just like Alpa has started the session. Since so many days, we are just thought regarding how to deal with this branch. Because as a IVF consultant, we both and our senior expert, Dr. Suryakant, we have decided to start once again a PRP because it's a old wine in new bottles. Because before 8 years we start this practice as a PRP. We also took some training, and at that time we are doing endometrial thinning purpose or ovarian regeneration. But during a process of time and because of heavy workload, we just forgot it. But once again, uh, as an expert, I just want to introduce once again this PRP therapy as a aesthetic gynecology. I don't want to tell is as a cosmetic gynecology, or otherwise we also told is as regenerative or reconstructive. So let's start. First of all, uh, basically cosmetic gynecology, one have to know what is area in which we are supposed to work. So first of all, pelvis is our like the main area to work as a PRP therapist. Second thing, who are the concerned person supposed to work as a gynecologist, MD or MS or DGO, or I can also introduce MBBS as a PRP therapist. Third thing, what is the basic experience required for that? For that purpose, first time in history, we are just introduced this free webinar to give a proper protocol, because everybody claim that we are teach this all the things but not in proper way. So let's start. Now today we are going to talk on PRP therapy in aesthetic or regenerative gynecology, not is a cosmetic gynecology. Next. Introduction. So whenever anybody just want to introduce any movie or any class, we have to just introduce that my name is Dr. Gaurav Chawda. I am MBBS, MS, MRCOG1, London, UK. I am also LLB, Foxy Fellow. Same way, this is the PRP therapy. PRP full form is platelet rich plasma. There are also certain other type of cocktail is available like PRP in the PRF, etc. PRP is innovative, regenerative, novel therapeutic modality. It is affordable. First of all, everybody in India can use and can provide this facility and easily perform. There is no too big expensive instrument is required for that, and also effective. That is the most important thing. It is effective. Okay. It is also non-invasive. So there is not that much surgical part is involved in this, and promising result if we follow proper protocol, which supposed to we learn from Dr. Suryakant sir or Dr. Alpa, and no side effect. If we are properly investigate patient with some infectious or anticoagulant disorder, we can use. It is a painless. No, I think little bit pain is there, and there is no downtime. So let's introduce first term in the cosmetic gynecology. Everybody everywhere aesthetic physician in the form of dentist, skin specialist, or any beautician nowadays use this no downtime. No downtime is a very important word in cosmetic gynecology. The meaning of no downtime means in nature, if we are doing some surgical work, it will take some time. But in this case, if we just apply it within 24 hours, we can see improvement. So there is the downtime is less or no downtime. No need of anesthesia. No, I think local lignocaine or sometime under GA, or I think better judge is Dr. Suryakant. We can also talk with him. It is walk in, walk out, coffee break procedure. this word is coming from Europe and American Aesthetic Society, because in their places they are just supposed to take a coffee break and walk in and walk out and just do this procedure and once again come back to their work. Okay. Now, where to use? Let's see. Female sexual dysfunction like orgasmic disorder, where there is a problem of sexual arousal or like sensual problem. Postmenopausal vaginal dryness, that is the most important one, vaginal dryness. Decrease sexual drive means less of libido in case of female sexual dysfunction. In case of male, there is the ED, most commonly known term, ED, erectile dysfunction, and PE, premature ejaculation. This is the major area in a male and female. In a pelvic region, I am not taking out any face part or any breast area or any buttock area. I will just supposed to focus only on pelvic area as a gynecologist and as a DNB, DGO, MS, MD or MBBS person as a medical aesthetic. Okay. Now, what are the fancy name just coming in the market? These are only three terms, but I know more than three terms. Like first is a O shot in female, second is a G shot in female, and third one is a P shot. This is the basically registered terminology. We have to pay $25 every year to this concerned person to use or speak this word. So please forgive me. I just introduced as a lecture because it is a free webinar. So there is important. I just introduced this O shot, G shot, and P shot. But as an Indian, we can like some is like some modulation done in this side, and we can use as a OH shot, OH, or Kama Sutra shot. This is a different name, but all the thing behind is this. We are just giving this type of shot. Okay. Now, previous one are the basically cause of sexual dysfunction in male and female. But in physiologically, since 2014 or 12, we are using these two point to needed in IVF or infertility practice. First is a decreased ovarian reserve, and second is a thin endometrium. These are two promising area in which as a IVF or infertility or a gynec person can do PRP as a promising therapy. Okay. Now let's see. First of all, when we want to learn any technique, we have to just go through a basic anatomy as a medical person. So as a gynecologist, I cannot teach you like a male pelvic region, but I can definitely teach you what is the pelvic area of the female and what is the most important point to be noted during your practice. So let's start. That is the two most important picture. You can take a screenshot of it and you can also put in your OPD table. So you can know how to start with PRP therapy. Let's start. First of all, anybody want to know regarding what is the G spot and what is the area of O shot? So let's see. As a gynecologist, we know this is the all part of the female pelvis. You can see properly, I think. This is the wall part of the female pelvis. This area is a mons pubis. This both part are a labia majora. Second both part in like pink color, it is the labia minora. Middle part is urethra. A part just above is the clitoral part and above it is the clitoral hood. This area is a hymen, orifice of the vagina, and just below it there is the perineal region and that is the anal opening. So this is the basic area. This is our part where we can inject it. So first of all, I just want to tell you what is the most accurate point where we supposed to inject a O shot. So to start with this, first I want to tell you there is no such O short point or G short point. It is not an anatomical landmark. Whenever you want to inject O short or G short, first of all you have to like specify with that person that what is the most sensual area you should put, or like you have to landmark that area, it is the O or G spot. But most probably both lateral part near urethral opening we can inject as a O shot. And second thing, you have to localize urethral orifice. You just put finger below it in the urethral tract, just below urethral opening in posterior part, dorsal part. There is the most sensitive part for arousal, which is the G shot. Okay, so that is the two thing. So this is the injection site 2 and this is the injection site 1. Approach from within the vagina. So that is the two thing. Now this is all like we are knowing since our MBBS time. Corpora, cavernosa of the clitoris, glands of the clitoris, urethral orifice, vestibule bulb, crus of clitoris, vaginal orifice, anal orifice. Okay. So like we are all knowing that whenever we want to like drink lemon juice, we just take cold water with sugar and lemon. But nowadays we are also added Sprite to increase our taste bud. So in the same way, whenever we give the P shot or O shot, we can combine it with like laser and HIFU. This is the both are EBD, energy based device. It is separate field. You have to know from starting, but you can add this both thing to improve your result. So that is the very useful thing. Next. Now method. Basically as a PRP preparing method, there are two type of method available. One is available by time tested senior person guided, their fixed protocol, standard protocol with no infection, and they have done evidence based practice and then prepare a protocol for Indian people commercially available in the market. Second one, you can also prepare in your clinic with a standard protocols. So these are the both protocol available for the PRP, but I most commonly recommended above one. Why? That I will be telling just after 10 to 15 minutes. So first of all, we are going through sensual dysfunction or arousal dysfunction or sexual dysfunction. Female sexual dysfunction protocol. First of all, I just want to brief you. Whenever I introduce or invite Dr. Suryakant, he will only give you a brief regarding PRP protocol because it is not possible in simple 5 to 10 minutes. But yes, definitely, sir will introduce all the methodical part, that which are the test tubes, how much their amount, but protocol we can provide you after on. So sir, please come and give your expert opinion or a standard protocol for this PRP in the three form. First for sexual, second for physiological thin endometrium, and third for P shot in the male. Thank you so much. Sir, please come.
Good evening, everybody. I would like to introduce about the P shot and O shot and other things. But before that, I would like to say that as we all know, human body regenerates itself, and it doesn't require much of external influence anyway. Whatever surgical or medical treatments we do, unless the body cells respond, you will not get any regeneration or repair. Now this particular repair and regeneration basically dependent on cell to cell stimuli, for which we have cytokines, cellular stimulants, neurohormonal stimulants, hormones and other things. But most important thing is, which we knew right in our second MBBS protocol, where we knew the cytokines are required for repair and regeneration, but now we know that they definitely come from the platelets. Now platelets do contain 60 types of growth factors which are required for stimulation of different kinds of stem cells and the cells in the body, which will lead to regeneration and repair. Now if we are not able to produce these cytokines locally, we can provide them as PRP shots or PRP therapy from the external sources, from the patient's own plasma and the platelets. What is important here is the concentration and the dose which we provide. We have to give a proper concentration of platelets, which has to be at least 10x concentration for general purpose, and for sexual dysfunction we need to 15 to 20 times concentration. For thin endometrium and ovarian protocols we may need 38 times concentration. Unless we provide this kind of a dose, we will not get the results. The second most important thing is the yield which we get from the PRP procedures we do. Now yield is very important. We should be able to get at least 90% of platelets from the blood which we have drawn from the patient, so that we are not wasting the biological resource. Fourth most important thing is the activation. Now there are certain situations where we need to activate, or we need to prepare the growth factors in a solution form so that they act very fast. Whenever we need quick regeneration and rejuvenation, we need to do activation. Whenever we need to use PRP on the surface like eyeballs and thin endometrium and other things, we need to create a lysate, or we need to create the activated PRP. Now unless we have these growth factor in solution, they will not work. So this is very important. We need to do prepare the PRP based on wherever it is required, the amount of blood which has to be drawn, and the concentration which is to be prepared, and the way it has to be stimulated is very important. Now yeah, the cost part. The cost part of PRP is again a controversy. People have been charging fortunes to do the PRP therapy. Not only that, there are a lot of commercial kits available in the market which come at a very high cost without any reason. Now what is important here is, PRP has been known to us for ages, because we have been creating platelet concentrates for any platelet related disorder, or even in dengue. We have been doing it in the blood bank very regularly, and we have been getting very good yield as well as very good concentration. There it doesn't cost much. So the same way, PRP prepared for the patient's treatment also should not cost much, and as it is patient's own PRP or plasma, there should be no reason for any complications caused because of PRP. Now the only contraindication for using the PRP therapy is patient having bleeding disorder. If patient has thrombocytopenia, or patient has got a very heavy bleeding disorder, these are the contraindications for doing any PRP. And infection, local infections where the PRP is to be injected, if there is a local infection, that also is in contraindication. Anticoagulant side effect is not much, because we use very small quantity of anticoagulant. Still we have to consider it, because as it is the extraneous matter which we are injecting.
Yes.
So hope you like the thoughts of Dr. Suryakant sir and Dr. Gaurav sir. Want to become cosmetic gynec consultant? So like you also are thinking to come up with this branch? So how we can help in that? Because there are lots of the knowledge available on the YouTube, available in the books, available everywhere. But where to start, how to apply in a clinical way, in a standardized manner with a standardized protocol, that's very, very important. So for that, what we will be provide in the PRP module? In the future, we are preparing the different modules like the PRP modules, like the laser modules. So like in which branch you are interested or whatever the patients you have, you can select that one. So like suppose PRP module is there, so we will provide you the different protocols, that is the standardized protocol everywhere. So if you follow in just a right manner, you will definitely going to get the result. If you have 4 to 5 patients at one go, will try to come up with Dr. Suryakant sir and will help you in your clinical practice to build up this branch. Will provide you about the introduction of what kind of the instrument you have to purchase, how much space is required, proper will give you the numbers of proper vendors, different kits and the newer use of the PRP that you can apply in your clinic and the branch, that definitely we are going to help in that manner. Pharmaceutical branch, some medicines and the drugs, that is also going to be helpful when we combined with both this therapy. As just we talk like just example SUI. In mild SUI cases, if we add along with our pharmaceutical brand, if we add laser, if we add PRP, so that is going to be work. So I had just given that example. So there are lots of the things like how to tackle the permanent thin endometrium in infertility cases, how to do ovarian rejuvenation in a with the help of the PRP with very minimal like a complication or very it can become very cost effective to the patient and to us, that is also very important. So these are such eye burning cases are there we can introduce this branch, and definitely this is going to be help to build your career in a new way, as well as you can help to the patient also. So today this is the only one part of the cosmetic gynecology as we discussed. So PRP as a gynecologist is very, very important to us, because that as the sir and Dr. Suryakant sir and Dr. Gaurav sir has introduced us about the various uses of the PRP. So as we talk now in the field of infertility, we definitely take a help when we get in spite of all our measures like a persistent thin endometrium is there, when the patient AMH is very low and she is very keen to do the IVF with her own eggs. So definitely we can take help of the ovarian rejuvenation. Along with that, in the gynec part, like SUI cases we can able to treat. Then those who having the sexual dysfunction, so like vaginismus is also considered the one sub factor of the infertility. So such kind of the sexual dysfunction cases we can going to handle in a very standardized way. So definitely along with our routine, all the gynec and the infertility practice, we can combine with this treatment. So this is very, very important. So we had only, I had just introduced PRP therapy because that is the main part of our treatment. So that I had included that introduction as a main thing. But there are lots of the other things are there. Like, so if you enjoyed, you can also join our other modules. In future, we are going to build up the community and we'll going to introduce the newer things in the form of the laser, because there are different kinds of the lasers available in the market. So how they going to help in our cosmetic gynecology, where we can apply and where we can help to the patients, that definitely we can include in that. HIFU, that is also one kind of the laser technique. Botox therapy, as we had discussed, that is play a wonderful role in case of the vaginismus patient. then the surgical cosmetic gynecology and many more, like surgical cosmetic gynecology like hymenoplasty, clitoral hood reduction, mons pubis. So there are lots of the surgeries are available that we are not doing in a regular basis, and we just like ignore the patients that just do like vaginismus patient whenever comes to our clinic, we just send it to the psychological counseling, and we can like just spend 10 to 15 minutes to the couple, and we just say that it's a normal physiological process. Or whenever any patient comes to us for the checkup, we just take a relax, just take a deep breath, but actually there is a problem is there. So only need is psychological counseling along with you. If you apply like botulinum toxin for just like for the relaxation purpose, it makes the flaccid of the muscles. So what happens that during that time psychological counseling will build up, and once the mind is clear, the patient mind is clear that I had no pain, then definitely during that time psychological counsel is going to be work and she will be fine. So like her married life will be okay, and maybe she conceived naturally because the vaginismus had been gone. So like this way there are like many burning cases are coming up in our OPD where we cannot help the patient, but with this introduction of the new novel branch in field of the gynecology, we can definitely going to be help. So now sum up with Dr. Gaurav Chavda will do with this case.
So thank you very much for your patient hearing. But I think whenever these come, thank you so much. So all the people are thinking that just left the light channel. But there is one important take home message which I must want to give you regarding this science. So everybody claim this, it is like humbug or gimmicks. Cosmetic gynecology, aesthetic gynecology, a regenerative or like reconstructive gynecology is all are just fake. But I want to tell you one basic fundamental science behind it. If you are go to the if you go to a beauty parlor or like a dentist or like skin specialist, and you spend a lot of money for serum and cream and etc., a soap, a shampoo for face or for hair. So a female body or a male body have a most sensual and most pleasurable part which nobody just want to ignore it. So every 15 days or 1 month you just go to cut your hair, you shampoo your hair. So why are not we whiten a private part of female or male? That is the first thing. Second one, if you are just remove your chest hair every 6 months with a laser, so why not pelvic part? Because there are so many like dangerous infection are going because of not proper sanitization or proper hygiene of the private parts. So second thing, that one. Third one, if we spend only 5 to 10,000 every 6 months to improve Indian community and also our gynec community behind this part, so I think it is a revolution in all our faculties. So that is the first thing. Second thing, everybody come with you that we just teach you how to do this and that, but no one can tell starting from anatomy to the physiology to the indication, contraindication, cost, which are most specific protocol to use in which type of indication, and lastly 1 year follow up, proper follow up for every case. You can just go through this module and you can also increase your practice or your knowledge. So I definitely know whenever ladies come with SUI, whenever there is a dripping of the urine during laughing or sneezing or during intercourse, it may be very shameful for her. So you can just introduce a laser in the form of diode, Nd:YAG or CO2 laser, or you just introduce a HIFU for each loss, a cold loss. There is no any exercise or like any dietary misuse. You just shaping your body. Third one, radio frequency device. It is the most important because our dermatology partners, our dermatologist consultant always tell you can use radio frequency devices in gynecology in very safe manner with a principle applied for this, because this all the EBD have a specific wavelength like 1470 nanometer. I know it well. It is very important for vaginal part. Like they have three type of specific wavelength. One for hemoglobin, second form for melatonin, and third for water. If you know this knowledge, you are become genius in this field, and you can also improve your practice for laser, for radio RF device, HIFU, and so many other things. Like you can also use peeling and botulinum, etc., etc. So just go through it. For first of all, think if you want to become this one, yes, you can definitely join our course. After, if you contact on this number, number is 95193777244, and join our WhatsApp group. You can ask anything if you curious regarding this branch. It is a vast field. It is a sea like. You need to just dive it and just develop one specific expertization in PRP. If you satisfied with us, you can join our laser session. If you satisfied with both, IFU, RF, chemical peeling, and so on. So that is the like take home message from this one. After this, we are always like assure you that at a frequent time interval we will introduce this type of free webinar to develop awareness in the field of aesthetic gynecology, and whatever we provide is very much important because we provide the vendor detail, we provide the product detail, we provide the catalog with which type of the kit, improving or like any specific modalities, protocols, medicine of course, and a group which is most important for every gynecologist, and our proper our like under assessment. So that all we can provide you. Just one thing, you just click on WhatsApp number 95193777244. Thank you so much for a kind and patient hearing. And great day, it is Sunday. We took almost 1 hour, and so this is the end of session. If you have any question, we are ready till you satisfied in the field of cosmetic in the PRP at present. So please ask any question from your side, or otherwise we will be close this session. So if you have any question, just write down, we'll answer. And if we have not proper solution for that, we can also later on tell you regarding this thing. So I am just waiting for another 5 to 10 minutes. If you have any query, anything, like you just want to start from cosmetic or gynecology or aesthetic or PRP or stem cell or like fat grafting, or you have any exosmere, anything, you can just write down the question. We are eager to solve your problem.
One question is there.
Yeah.
Over expensive is for its use just for vaginal rejuvenation.
Dr. Trisha Das, sir, over expensive as per its use. Just for vaginal resolution, kindly opinionated, and number of the cases not that much as per the machine price. I think which type of techniques you just want to clarify, so I can for laser. Okay, yeah. So laser is definitely a another category. Laser is basically in broad term you can tell it as a EBD, energy based device. So in there are 4 to 5 things that we are just supposed to put down. First is the laser. In laser also there is a CO2 laser, which is like it is more coarse term than come diode, and nowadays there is the Nd:YAG we can use. Second is a HIFU, and third is a most commonly nowadays RF device also use. Your question is it is expensive. It's okay. We have also some tricks for this one, because as an Indian and properly as a Gujarati we have all type of tod jod for that. Yeah, I know it very well. The laser machine starting from 40 lakhs to 1.5 crores, but we have also some good standard connection, and rented machine is also available from our side with standard protocol, with OT assistant, which also help on your place with a minimum. Can you assume how much cost for a one laser or a one RF or one HIFU device at your place? You can imagine. We can also provide that facility also in the form of rented laser or HIFU or like a RF device. So that doesn't matter. But the beauty of this EBD device, laser device, is that it will take only a 2 minutes. It's a revolution in cosmetic and gynecology field. It will take only 1 minute to 1.5 to 2 minutes. There is no pain, no anesthesia, and immediately within 12 hours you can see the result. On next day morning, probable your patient will call you that yes, I have solved the problem of dry vagina. That is the first thing. Second, yes, I feel little bit tightness, vaginal rejuvenation in the form of yes, next day morning. Or third one, the problem of SUI is suddenly change up to the mark. So these are the beauty of this thing, and I think minimum instrument, minimum OT setup, you can also take.
Question is, want to treat SUI with minimal investment. Which one you will suggest?
I think the HIFU is the best one, but you can also use the laser as alternative option, because it is a commercially low cost than the HIFU. So I think starting from 10 to 14,000 per session with instrument and with a expert person, which also helping you on that point, you can also offer that to the patient. In I think more than not 15,000, including all thing with laser machine or with an expert person on your place, like it may be a Delhi or Bombay or Gujarat or Assam or South or any part of Indian area. Yeah, you want to know regarding the laser 1470. Yes, I just want to give a basic info regarding it. Yeah, all these energy based device have a typical frequency to work. So this is all the it is a photo energy spectrum. You whenever you introduce 1470 or 1180 or 1285, this is the different type of wavelengths in which this specific energy is work. And in our body basically there are 3 things. One is the water, second is a melatonin pigment, and third one is a hemoglobin. So whenever you just go for a vaginal rejuvenation or vaginal tightening or SUI or repeated infection, its vaginal part is all covering with the water. So you just introduce this wavelength 1470. It is for doctor understanding purpose. You does not require anything proper. Your a person which we will send to you. He will or she will adjust that 1470 or whatever the wavelength required for your specific patient, but it is safe. Believe me, there is no patient since this date any complication or any contraindication, except if you have any magnetic device or like any arrhythmias device or specific metal device in body, because some of the like instrument is also working in electromagnetic field. Otherwise you can also use in diabetic, or you can also use any anticoagulant medicine containing person. So this all can use. Yeah, there are two newer one device. This I just spark on that. That is the one is the M-Cella chair. Have anybody go through this term M-Cella? It is a high frame device. Anybody know this? It is a electromagnetic like principal operated chair. Is just chair. It's a magic. You just I want to show you. You just see. This is simple chair. This is the simple chair. I just put it. Patient is coming in your OPD. You just properly consult it. Patient tells that yes, I have problem of SUI. You tell you have to take this 1 or 2 or 3 session. You just take consent and just sit patient on this chair for 3 minutes with cloth, without anesthesia, and within a 3 minutes patient must tell next morning that yes, I have properly all the symptom of SUI will recover. Yes, definitely. So this type of device are also coming, and don't bother. We have all these new entity also including in these modules. So that type of therapy is also now in coming in the gynec field. But the thing is, you have to just start this field practice. So that is the like simple M-Cella like chair also now coming. It is the electromagnetic based device. So that is the
Next question is, how is the result with RF for vaginal rejuvenation and SUI?
all the instrument like laser or like RF 100% result, except you have a cystocele or a rectocele which must operated surgically. Otherwise all type of SUI, vaginal laxing after delivery, yes, whoever practicing as a vaginal gynecologic surgeon like delivery or cesarean episiotomy, post delivery a multiple patient come with the madam or sir, you have just gone through my delivery and I have a problem of laxity vagina and I have problem in like our intimal time. So at that time you can also do this introduce this laser or RF. All are equal. Don't worry if you are using HIFU, you use HIFM or laser or RF. Yeah, definitely we'll provide you which is the best one in which condition. So we'll give you all the introduction. But don't worry, I promise 100% assured that no technique is harmful for your patient. You are just introduced in your area with minimal investment with rented instrument 15,000 or I think 15,000, and you just start your practice next day morning. Also, if you are inspired by this session, you can tomorrow morning just give advertisement to social media or your mobile or newspaper or pamphlet, and you just said I am a cosmetic gynecology and I have started my SUI or laser tightening device, and you can go through, because expert person will definitely come to your place and will help you to solve this problem. Yeah, I know it well. Whenever you are doing any surgical or non-surgical procedure, after some time because of age-related problem, after 6 months or 1 year, it may be come with the recurrence, but at that time you once again advise for next session, because I always advise that no one should tell that yes, it is a 100% working device. You have to say yes, you go through this. If you are improving, then you can come after 6 or whenever you have problem, take next session. There is no pain surgically or like stitch, or is like not it that much expensive procedure.
Cost of M-Cella chair, and it is need to buy all this.
No. I think there is no need of buying of chair, because there are so many varieties that are coming like in booming way in our industries. M-Cella chair is more than costing like 60 lakhs or 1 crore at that time. But nowadays, basically This market, this instrument coming from three region only. First is a European or American area, second is the Korean, and third one is Chinese. As we know, I don't want to like any humiliate any person, but I think Korean instrument is a medial option. You can purchase that about 4 to 6 lakhs, yeah, or up to 10 lakhs. Did HiFM chair or MCella chair. MCella is the trade name. You cannot use MCella as your branding. You just go through electromagnetic chair device and you can introduce your practice. MCella is a company marketing. So you go through that. We have a chair like magic chair. You can just sit for 3 to 4 minutes, and if you improve, you can come after 15 days and take next session. Yes.
To check whether company is selling electromagnetic chair and not just fooling you.
No. These are not a fooling thing. For that purpose, we are always there. We will help you and we will provide you a genuine vendors and genuine company and genuine protocol. Don't bother, don't worry. We are checking more than 100 times and then we introduce to you, because whenever we introduce to you, we don't want to gimmicks or like don't to cheat you. So don't worry. That is our responsibility, that we will not provide you any number. In the same way, today I just like very confidently and like proudly introduce Dr. Suryakant sir. He is our like senior person. But if you are use sir's PRP kit, it's a standard practice in all India. I have used in past, but I told you, because of heavy IVF practice, we just keep it another part, and we are just going on through the IVF practice. But definitely since I think sir 2015 or 16, yes 2016, we are just use this type of kit. It is definitely work. And sir, I think amazing the cost of like just you think what is the cost of sir's PRP kit? If anybody, please write down the any figure on this chatting device. Yes, PRP kit. You can just go through it. Anybody? What is the cost of PRP kit? A standard commercial SIRS PRP kit, time tested PRP kit. This is not a commercial marketing. Just forget it. As a gynec person, as a your friend or like your senior person, can anybody? It's not more than 1000 rupees per kit, including instrument, disposable, and they are all UV like disinfected. So you don't worry. All the things are like we give you in a proper like proper screening. We can provide you the number and etc. I think cost of PRP kit is not more than 1000 rupees. Also, there is a stem cell kit and fat that autologous therapy kit is also available. But that purpose you have to purchase some other instrument. A Sepex is a good one. We have also, yeah, I just want to introduce one another thing. Whenever you want to go through a PRP kit, if you want to take 100% result, there is a Sepex machine is also available. Though problem is that is costing more. Like whenever a foreign people come to you for PRP or autologous stem cell therapy, they always ask for Sepex kit. Sepex is a Switzerland-made machine which is also concentrate like near about 99% that sell. As per my opinion, gynecologist, I am not expert, but Sepex is a like big bull in this market for the autologous cell therapy. So I think we can also offer this Sepex machine on rent in history. No one can introduce a rent machine. These are the thing, because we don't have to purchase this much cost, like about 50 lakhs Sepex machine. We also contacts that we can also provide you the details. Don't worry, that is not like our commission or like it's like our friendship deal too with you. Someone asked that if we have a more order like 5 or 10, yes, definitely we will request her to lower down the cost. It's like our also same fraternity, our doctor, so we will also help you to reduce like little bit, don't worry. And lastly, there is no cut or commission in this all the thing. Our motive is a pure 100% gold, that we want to introduce cosmetic gynecology without any gimmicks with every module. This is the first part. We are claiming 100%. Whatever we tell, we will first practice evidence based and then we introduce. So don't worry, we have no any cut or margin. We are just give you a straightforward track for any instrument with a low cost standard machine and without any contraindication or adverse effect. So let's see, within 5 to 10 days I also want to arrange a free webinar on EBD, energy based devising for laser, after that with a radio frequency device, and then also HIFU. And if possible we will also introduce like a botulinum toxin injection on private part in the first time. In first time for vaginismus with hyaluronic acid injection also we can introduce, but it is only specific for aesthetic, regenerative, reconstructive, and lastly not cosmetic, but including in this in gynecology field only for pelvic area. So we can improve our practice, and for cosmetic purpose we also remove the permanent hair remove in pelvic area, and also whitening, because genitalial outer external genital sometimes may be a blackish area. So there may be problem for like sometime there is a sensitivity during the intimate time. So we are also introduce that part of lecture, that how to whitening female private parts and pelvic area. So that is all the thing with a pure intention and a good motive for only our gynec colleague in India. And this is the one novel approach that everybody claiming that come to our place and take participate in 3 days or 4 days. For like our the busy gynecology is not possible. So we will provide first Indian commercial hands-on training modules that I think 99% there is no need of anybody who see or go through these videos and lectures. They can own start their cosmetic gynecologist at remote places, like some are from Assam or Nagaland, or some are from Jammu Kashmir or like Ladakh area, or some are from like Trivandrum or remote places of Kutch and Gujarat. They can also just take one good speed internet, and with a good mobile or like laptop, you just go through our module, properly watch video, and if you have any question you can put in our groups. Group 4 types. First is for technique purpose, second for video purpose, third is protocol, and fourth one is pharmacology and vendor name in there, or how much costing. We are divide in these 4 community, and just go through same interest and same test gynecologists also you can they will take an interest in this group, and we can do lot of in future.
Gynec practice can practice hydrofacial and laser hair removal for PCO patient.
So simply it is a very controversial person, and anybody want to ask regarding this as a gynecologist, because I am a MBBS, MS, MRCOG1, London UK, and also LLB. I am a medical legal fraternity for this person. So I want to give a neutral answer for this. Yes, if anybody from Indian Constitution completed allopathic MBBS graduation can, as a MBBS person from Indian Medical College, can go through hydrofacial, any medical aesthetic. I just want to introduce a term, not only aesthetic, it is the medical aesthetic practice. Can anybody done this type of practice? It is legal, no problem, because till date there is not official, there is no official course is introduced by government or by any American, European, African, or like any fraternity have developed this certified medical course. So yes, as a MBBS or as a DNB or as a MDMS, you can DGO, anybody can start this non-surgical practice For surgical practice like hymenoplasty or labioplasty, you have to go through the MD or MS in gynecology. So you can start. There is no problem. But do ethical practice. Always follow a standard protocol, a gold standard vendor, their protocols, their products. I think there will be no any problem in future, and you can also develop a good name in your area. Yes, if you are just introduce your name in this area in any state, you just click as a first cosmetic or aesthetic gynecologist. But please, 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 just start with a cosmetic gynecology or aesthetic gynecology. Start with the pelvis, because there are so many beautician and beauty parlor and aesthetic and dentist and dermatologist and etc. BHMS and BMS are just claiming for the hydrofacial and laser and etc. So just go through this pelvic part, and definitely you will achieve so much in so many things in this field. Because since 2012, when nobody knew regarding this science, and since that time we are just practicing this PRP and stem cell, because we have a two company, Magic Stem Cell and second is Stem Cell Private Limited. These are both company which are operated by us as a stem cell scientist. At that time we are like research in the thin endometrium and ovarian rejuvenation, and it is a Magic Stem Cell Limited, Private Limited. These are both company. As a director, we are doing this protocol. Because of a heavy practice, we are just lessen the practice at that time. But once again, when I go through this 1 year, all this cosmetic guys, I know that oh, it's our branch, and we are the concerned person. So why don't we start once again teach and also help to this patient? So that's why we are just starting with PRP. Because we are doing this since 2012 in Indian history. So just we are a right person for PRP and stem cell, autologous stem cell, bone marrow stem cell, fat derived stem cell, and newer terminology, exomers. So these are all the things. Yes, thank you so much. I just want to stop and end up this session. If you have any question or you just want to go through this module, you can contact 95193 77244. Thank you so much.